Hi, my name's Charity, and I'm going to be doing a PICC blood work for INR and a sacral wound dressing. So I gathered all my supplies that I need, and I'm going to go to the patient's room. So I'm going to walk in, wash my hands. I'm going to do my entrance safety check, making sure the call bell's within reach, bed's at the lowest position, and the patient's not in any distress. So I'm going to introduce myself. So hi, my name's Charity. I'm going to be your student nurse today. Can I just look at your wristband? So I'm looking at the wristband. It says Rick Steves, and then it says their birthday and no known allergies. So that matches the physician's order sheet. And then since they have expressive aphasia, I will just ask them to nod their head if their name is Rick Steves, so they nod their head, and if this was their birthday and if they have any allergies, so I know that it is the correct patient. So I'm just going to let them know that I'm here to be drawing some blood work from their PICC, and as well as doing their wound care. So is that okay with you? Nod your head if it is. So they nodded their head, so it's okay. So I'll just ask them to nod their head if they need any analgesics before the wound care, and they said no. So I'm just going to raise the bed, and then I'm just going to set up my supplies. So I'm going to wash my hands. I'm going to put on my gloves. Ooh, these are inside out.
They're easier to put on that way.
Yeah. Okay, so I'm just going to ask them if I can set my supplies up on them, and they said that's okay. So I'm just going to get everything ready here. Okay, so I'm actually gonna get 4 of these. This will be another one because I'm gonna flush with this one, and then I'm not sure if I have to do that, but we're gonna ask. Okay, so I'm just going to get everything set up. So I'm gonna prime my pre-flush, and then I'm going to make sure that this is open, and then I'm going to prime my post. So in the policies, it says that you have to flush after a blood draw with 20 cc's, and then it also says in the policy that for a PICC you have to lock with 10. So I'm gonna pretend that this is 10. Actually, I'll just use this one. But yeah, we'll ask about that. So I'm primed this already. Okay, so now that we have all that ready, I also have my requisition form with me as well, and then I'll also just make sure that that matches the patient's wristband, which it does. Okay, so I'm going to clean. Oh, and I'm going to use the red lumen because it is the one that we use for blood. Is it bigger? It must be bigger. Anyways, it's bigger. So clean it for 30 seconds, let it dry. And then I'm going to, ouch, did I forget something? Oh. Okay, so I'm going to flush with 10, and then I'm going to withdraw 5 to 7. Throw that out. And then I will get my Vacutainer. Okay, and then it's gonna fill on its own. So then when it's done filling, I will take it out and invert it 8 to 10 times. So I've inverted it 8 to 10 times, and then I will just flush with 10, well, I'll flush with 20, doing push pause. Okay, and then I'm going to lock it with 10. Okay, so now that that's done, I'm going to make sure I put the patient's sticker on here with their name and their date of birth, and then I'm going to match it to the requisition form to make sure that it matches, which it all does, and then I'll just go over the requisition form, making sure it's filled out properly, so it's for INR, and just make sure that I sign and date it. And put the time, and then I will take the requisition form and the blood, and I will go to the door and get my buddy nurse to take this to the lab stat for me. Okay, so they took it, and so I'll just make sure that once I leave, I will write an IPN about taking the blood work. So I'm going to take these off.
INR is only inverted 3 to 4 times.
Whatever, dude. I'm going to wash my hands. And also there was no infusion running. I just wanted to clarify that because there wasn't, but I'm glad there wasn't because I actually did check. Anyways, okay, so now I'm going to do the wound dressing. So I've already asked them if they needed analgesics and they said they didn't. So I'll make sure that the bed is at waist level, and then I'll make sure that I'll clean my table before I put my sterile stuff on it. So I'm gonna wash my hands and then start setting up my sterile field. So I'll put the blue pad down and I'll ask them if it's okay if I put my garbage here on them, and they said that it is okay. Also, we know that we have the right patient because we didn't leave the room, so I don't have to do those checks again. Okay, so I'm going to just set my garbage up here. So much shit.
I flip it the other way. For a crime of videotaping.
Okay, so I'll just wash my hands again just before I'm doing this. Okay. I wouldn't be touching a bunch of stuff over there. Okay, well that's awkward. Okay, well I'm just gonna move my field because the kettle's in the way. I wouldn't touch it like that. Okay, so I don't need this. So I'm just gonna pass it to myself and throw it in the garbage. And then I also don't need this, so I'm gonna throw that in the garbage as well. And then I'm just going to move this. And I'm going to set up my sterile field. Okay. My scissors aren't in here. So I'm just gonna add my scissors to my sterile field. Throw that in the garbage. Throw that in the garbage. And I'm gonna add, might be missing these. I didn't add them back into my thing. I'm gonna add this. Oh, it's ghetto, so it's pretty shitty. Okay, so I'll throw that out, and then I'll just pretend that I had another package because they were drying. So I'll just put these back in here, and then I will open them and add them to my tray as well. They aren't ghetto, so that's nice. And I'll throw that out. I'm just gonna move this shit out of the way. Okay, get my sterile gloves out. I'll make sure that I have my ruler here. I will add some cotton swabs. Not sure, but anyways, I don't want to call them Q-tips. So then I will leave these ones out because I will be using them to measure stuff. Okay, so now I'm using acrylics, and it's over here. I would leave my patient's room. So I'm gonna open this away from my field. I'm gonna add it to my, okay. Ooh, that's a nice one. Okay, and then I'm going to add my water. So I wouldn't reach over my sterile field. Whatever, normal saline. Okay. All right, so now that I've set up everything, I'm going to wash my hands and put on my clean gloves so that I can assess the wound. So I'm just going to take off the tape and then look at the abdominal pad. So there is a moderate amount of serosanguinous drainage, and then take off the 2 4x4. So there's also a moderate amount of serosanguinous drainage. There's no odor. So then I'm going to take this and remove the packing. And so there's a copious amount of serosanguinous drainage on the packing. So I'll throw that out. So I'm just gonna assess the wound. So the peri-wound skin, there's a little bit of redness and edema. I can also see some serosanguinous drainage inside. There's also some necrotic tissue, as well as there is a small amount of slough in the wound bed. So I'm just going to assess for any tunneling or undermining. So I'm going to poke around. Okay, so there's some undermining here, so I'm just going to measure it. And so it is about 3 centimeters. And then I'm going to assess, okay, so we have some tunneling here. So the tunneling is about 3.5 centimeters. Oops. And then I'm just going to measure the depth of the wound. So I'll go on the deepest part. So it looks about right here. And it is about 2.5 centimeters. So I will also assess that after I clean it. So I'm going to take my gloves off and throw them out. And I'm going to wash my hands, and I'm going to put on my sterile gloves.
Do you want to do the length and the width?
Oh, yes. Thank you. Doing length and the width. So it's 10, the length is 10, the width is 9 centimeters. Now I'm going to put on my sterile gloves.
Was there an odor?
No, I said there.
Okay.
I said that at the beginning. Okay, so I wouldn't turn my back to my sterile field, but I'm going to anyways. Okay. Yeah, that kind of hurt. Okay, so now I'm going to start cleaning the wound. So I'm gonna pull up about 30, I was gonna say centimeters, 30 mils of normal saline, and then I will retract the needle from this and put it in a place where I'll throw it in the sharps, or I'll actually just throw it in the sharps bin because it's right there. And then I'll attach this, and then I will pull it away and just prime it to make sure I'm not squirting any air onto it. And then I'm going to clean from the cleanest to the dirtiest area. So I'll start from the middle and just clean it using pressure until the drainage runs clear. So now the drainage is running clear. So I will throw that out and then I will dry it. I'm just going to dry in here, making sure not to push too hard on the tunneling and undermining areas, as we don't want to cause any damage to the wound. Okay, so then I will dry the tunneling area. Okay, I'm just drying it as best as I can, as I don't want to cause any trauma to them, because I remember them saying something about you won't be able to get the tunneling and undermining too well with that. And then I would have added another one, I guess, because it's not really dry, but I'm just going to dab over here, but I wouldn't do that in real life. That would have been another one. Okay, so now that it's clean, I'm just going to Okay, so I'm going to clean the peri-wound skin. So I will, what? Okay.
You see that we had ghetto 2x2s too.
Yeah, I know. So I'm gonna clean the area farthest away from me first with one swipe and then throw it away, and then I will clean the area that's closest to me with one swipe and then throw it away, and then I'm going to dry it. So I'll dry it in the same manner. And that's kind of fucked up. Okay, so clean or dry it and throw that out. Okay, so now I'm just going to assess the wound bed again. So like I said before, there is a small amount of slough in the bottom of the wound bed. There's also some undermining at say 1 o'clock to 2 o'clock, and then there's also tunneling at around 7 o'clock, and there's a little bit of necrotic tissue, and yeah, that's it. And the peri-wound skin is a little bit red and has some edema, and then the rest of the tissue is granulation tissue. So I would say there's a moderate to copious amount of that. I don't know, 80%? I don't even know. Okay, so now I'm going to pack it. So this one's fresh, so I'm not really sure how this is gonna go. Okay. So I'm gonna bring that away from my field. And I'm just going to take this, make sure I'm not dropping it below my waist, and I'm going to just wring it out over the garbage. Okay, so now that we've done that, not bringing it below my waist, I'm going to, unfortunately, ew, why is the water, or why is that white in there from this? Delaney said we have to pack the tunneling and undermining with a fucking Q-tip. So, I will start packing.
Is this stuff nicer though with a Q-tip?
Yeah, it actually is. Okay, another question that we're going to ask is that, like, can you just like start from one side and go to the other side with packing and not do like the tunneling and undermining first? So I'm just gonna like work my way to the other side because I feel like that makes more sense to me. But we'll get back to you on that one. So it's okay if I touch the peri-wound skin a little bit as I've cleaned it, but I'll try not to touch too much of it as we don't want to compromise the, I guess, the sterility of the wound. So we're just gonna make sure that we get it packed, not too tightly, but just enough in the tunneling and undermining to fill the wound. Yeah, this is actually not bad. Okay, so the tunneling feels good. The undermining also feels good here. I think I would add a little more there. And then I would cut it. Okay, so I don't need this. So then I would grab my scissors. And I would probably like try and bunch it up and like cut it like that so that it just falls down there. So I'm gonna throw these out. I'm actually gonna cut it. So I'll just pack it in. So that looks good. It's quite fluffy. It's not, it seems to be covering every area. Okay, so now I'm going to cover it with 2 4x4s. And then I'll consider myself not sterile. I'll grab my abdominal pad, put it on top, and then I'll grab my tape and I will tape it down to the patient skin. And then I will take my gloves off, I'll wash my hands, I'll clean up all my supplies. I will just note the patient's facial expressions as they cannot speak. So they're not showing any signs of non-verbal signs of discomfort. So that so we can, I guess, assume that the patient tolerated it well. I'll ask them if they are in any pain, and they shook their head. And then so I'll just do my exit safety check, making sure the call bell's within reach. They're not in any distress, but they're at the lowest position. Then I'll leave, and then I will write an IPN note with all the characteristics of the wound. My fucking glove, it's from snapping it. Anyways, so I will write down all the characteristics of the wound. So the tunneling and undermining, the length, width, depth, any odor, the characteristics of the wound bed, so the necrotic tissue, slough, granulation tissue, how the patient tolerated it, if they needed any analgesics, and then what I dressed the wound with. And then I will also record all of that on the wound care assessment sheet, and then I'll also write an IPN note of how I took blood work from their PICC line, their INR, and then I sent it to the lab.